Today I will be performing a neurological assessment on a 25-year-old male. Before I begin the assessment, I will wash my hands. Then I will walk into the room and I'm observing for his general health state, his appearance, his height, his build, making sure his dress is appropriate for the situation, and his hygiene. And then I will assess level of consciousness, but to do that, I can ask a few questions such as, can you state your name?
John Sucre.
Okay. And can you tell me the date today?
October 19, 2012.
Okay, thank you. From this information, I can tell that he is alert, oriented, he follows commands, and his speech is within normal limits. Now I'm going to test cranial nerve 5, the trigeminal nerve, and to do so, I'll take this Q-tip here. This is going to be a soft sensation, and this is sharp, okay? I'm going to touch your forehead, cheeks, and chin, and you tell me what you feel, okay?
Okay. Sharp.
Okay, good. I can tell that his trigeminal nerve is intact. Next, I'm going to assess cranial nerve 7, the facial nerve. And to do this, I'm going to look at the symmetry of facial movements. I'm going to ask you to smile, okay, frown, puff out your cheeks, wrinkle your forehead, close your eyes, okay, pucker your lips, and show me your teeth. Okay, good. Next, I'm going to assess cranial nerves 3, 4, and 6. To first start off, I'm going to look at his pupils for shape, equality, and size. Okay, and that's good. Now I'm going to assess the 6 cardinal positions of gaze for nystagmus. Okay, keep your head straight and just follow my finger with your eyes. Good. Now I'm going to have you cover one of your eyes. Okay, look at my finger and then look into the distance. My finger and into the distance. My finger and into the distance. Okay, good. And I would repeat that on the other eye. Now I'm going to have you look at my finger as I go in and out from your nose, okay?
Good.
Good, and that's checking for accommodation. I can now tell that his pupils are equal, round, and reactive to light and accommodation. Next, I'm going to assess cranial nerve 2. I would check his visual acuity, and now I'm going to check his peripheral vision. You keep your head straight forward and tell me when you see my fingers, okay?
No. 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 No.
Okay, good. Now I'm going to test cranial nerve 2, the acoustic nerve. I'm going to have you close this ear. I'm going to come over here and whisper something to you, and I would like you to repeat it back to me, okay?
Good. Today is Friday.
Okay, good. All right, and then I would repeat that on the other ear. Now I'm going to assess cranial nerves 9 and 10, and in an unconscious patient, you would test the gag reflex. In this situation, I can tell that it is intact because he is talking to me. I will then ask you to open your mouth and say, ah.
Ah.
Okay, there I'm looking for equal rise and symmetry of his uvula. Now I'm going to assess cranial nerve 12. I'm going to ask you to stick out your tongue and move it from side to side. From side to side. Okay, good. Now I'm going to test fine motor function. I'm going to have you use your pointer finger, touch your nose, and then back to my finger a couple of times. Okay, good. Now I'm going to have you take your fingers to your thumb rapidly. Okay, good. And now take your heel and run it along the opposite shin. Okay, and then other way. Okay, good. Now I'm going to assess his gait. I'm going to have you stand up, okay, and just walk normally across the room. Okay, and you can come back. Okay, now I'm going to perform the Romberg test. I'm going to ask you to put your feet together, arms at your side, okay, and close your eyes. Okay, and here I'm assessing his balance. Keep your eyes closed for about a minute. Okay? And now I'm going to ask you to do heel to toe walking across the room here, just like this. Okay, good. And you can come back here and have a seat. All right, and that concludes my neurological assessment today. I will then wash my hands and exit the room. Thank you.